Good morning, everyone, and welcome back in. Do you know what? It almost seems like science fiction, but the CyberKnife is so real. It's reaching tumors and lesions that were previously untreatable. You can find the most technologically advanced CyberKnife at Oklahoma CyberKnife. Today, Dr. Steve Gaede and Diane Heaton are here with us this morning to share information about the CyberKnife. Good morning to you both.
Good morning.
Okay, Dr. Gaede, let's start with you, sir, if we can. Explain to me what the CyberKnife is, what it does.
CyberKnife is a revolutionary way of treating tumors and various other conditions. It involves radiation. Unlike the old days when we really kind of use a shotgun approach, this is a highly precise treatment with really sub-millimeter accuracy. It can get to tumors and other conditions and treat them without affecting the surrounding tissue very much at all. It's a real revolutionary advance in that kind of treatment.
So who should seek treatment with this? Is it just anyone with tumors, no matter what the size?
Generally, of course, I'm a neurosurgeon. I focus primarily on brain, but one of the things that's been very exciting has been the fact that we can treat brain, spine, pancreas, liver, lung, kidney tumors. There's almost limitless possibilities for the future. Those are just what's been proven so far.
Okay. And then explain the video that we're looking at here. Is this basically the procedure?
This is a patient getting ready to be treated. There are no knives, there's no blood loss, there's no anesthesia, there's no frame to hold the patient's head. But what we do have is a robotic arm that delivers this computer-driven radiation. It's painless. The patient lays there. We often put a mask on their face to hold their face in exactly the correct position. The computer in the machine can account for breathing. It can account for any subtle, slight movements the patient makes. That's what makes it so revolutionary and allows it to be so accurate.
Are you ever working and just thinking, this is so amazing?
It is. It really is.
I mean, wow. And then Dr. Heaton, I mean, you are the medical director of Oklahoma CyberKnife. Kind of tell me your experiences with the CyberKnife and the patients that you've experienced.
Yes, we actually started about 15 years ago doing radiosurgery in Tulsa, and this has been amazing. This is a logarithmic leap from what we were doing literally even a few years ago. We can treat much more different tumors, treat them quicker, treat them much more accurately, and that I'm seeing just amazing results. Every day I walk in and look at new films of patients we've treated, it just amazes me how well this is working.
Yeah, and would you recommend this to anyone who fits the criteria?
Who fits the criteria, yes. I think it's an option. Obviously there are patients who are appropriate and who are not, and but we are very excited. We're seeing some wonderful results and very excited about this technology being here in Tulsa.
Yeah, we've interviewed some of your patients before on this show, and I got to tell you, listening to their stories and going from the diagnosis of I have cancer to I do not have cancer. I mean, that is just amazing. And you all get to see it firsthand. What is that experience like for you all?
It's wonderful. You know, there are patients who have not just cancers, but blood vessel abnormalities or pain in the face called trigeminal neuralgia, and the treatment for those kinds of conditions is so gratifying because it had been formerly so hard to treat.
Yeah. Doctors, thank you both so much for coming in. We appreciate it. It's always a pleasure to talk about this. I am so amazed and so thankful for what you all are doing. I appreciate it. If you all would like information about Oklahoma CyberKnife, they are located at 6802 South Olympia Avenue. That's roughly 71st Street and Highway 75. Give them a shout, 949-6676, or their website, oklahomack.com. All right, now let's check in with Mike Collier. You're talking